तो तुम तो हटो पीछे से। इधर तो देखो। Hello everyone. Good afternoon. I am Dr. Puneeti Ballega Gandotra. I am an obstetrician and gynecologist practicing at Sealal Hospital, Ambala, Kent. From last 10 years, I am conducting deliveries and I am monitoring pregnant patients. And every time I feel like planned pregnancies have better outcome in comparison to unplanned ones. So for this planning, you need an appropriate counseling with a healthcare worker. It doesn't mean counseling between a husband and a wife. It needs a healthcare worker in between you. So today, I will be dealing regarding preconceptional counseling. Preconceptual counseling, in it, pre stands for before and conception is related to being pregnant. So this counseling basically starts before pregnancy. It means you have to be ready before you are pregnant. Your body should be in control before you are getting pregnant and you are totally healthy. This counseling basically includes identification and modification of certain risk factors. Either they can be biological, behavioral, or some medical reasons, and certain interventions to improve the overall maternal health so that a woman can be healthy, then she can plan a pregnancy so that she can lead to a positive impact on her baby, her fetus, her child. In simple words, why I am talking about this preconceptual counseling. Even I am getting a question also, why this preconceptual counseling is important. So the reason is when you have been properly counseled before getting pregnant, there are many advantages. Like there are decreased chances of preterm birth, there are decreased chances of low birth weight babies, decreased chances of pregnancy related complications, and decreased chances of many birth defects like CMF. So you can have a future generation which is very healthy, and your pregnancy will be good, your baby will be good, you both will be healthy. So when is the time, when should we start preconceptual counseling? The ideal time is months prior to conception. Ideally, you should check a healthcare worker or you should visit a doctor regarding your problems at least 3 months prior so that you have the time to change your body, you have the time to change your illness, your medications which you are taking so that they do not hamper in the future pregnancy. And ideally, it is given to all women of reproductive age group. Even the male partner is also involved so that he can be involved in the health of her wife, he can be involved in the health of her child. So, what are the steps of preconceptual counseling? When a person comes to us in our clinic, first of all, we take a detailed medical history. That is, we ask them about their present or past history of any disease like diabetes, hypertension, tuberculosis, asthma, or some epilepsy like diseases. And we inquire them from how long they are having this disease, what medications they are taking for their illness, and is the disease is under control. We have to inquire all these things so that we can provide them some substitute for their medicine. We can change the drugs which are safer for the baby and the mother in pregnancy, and we can either reduce the dose of the drugs they are taking. So drug history is also very important. We have to ask them which antihypertensives they are taking, which oral hypoglycemic agents they are taking for diabetes, what anti-epileptics they are taking, and if they are taking any acne treatment like steroid creams or isotretinoin creams, we have to ask them and then we have to modify it. Like we have to say them these steroid creams are not safe for the baby, so they have to leave it or taper it before being pregnant, so it does not hamper the health of the baby and the mother. Family history is also important. Sometimes in diabetes cases, we have seen that the mother is okay, the mother who is going to be pregnant is okay, but he or she is having a very strong family history of diabetes, like बच्चे की नानी को डायबिटीज थी, तो there are more chances कि pregnant woman को भी pregnancy में diabetes हो सकती है. तो family history is very important. Next comes to personal history. We have to see regarding whether the woman is in habit of smoking or alcohol intake, or she is having a history of any drug abuse. So we have to inquire this. We have to modify her habits before she becomes pregnant. The most important is dietary history. In dietary history, we have to take care that women enter in her pregnant state in ideal weight. Like she should have proper well maintained BMI. She should neither be very thin, neither be very obese. Like obese patients have chances of having fertility issues. There are chances of abortion, chances of getting diabetes in pregnancy, chances of getting hypertension in pregnancy, or they'll end up in stillbirth or congenital malformation or macrosomia. Similarly, very thin people also have fertility issues. They either land up in infertility, abortions, or preterm birth, or anemia is very common in underweight persons. And they may also land up in lactation failure in postpartum period. So getting an ideal weight in pregnancy before getting pregnancy is very important. For this, we have to take a multidisciplinary approach. We have to consider a dietitian also along with the gynecologist, and both of them will educate the women regarding her diet habits, regarding certain information giving to her, like so that she can maintain her adequate weight. Some exercises are also included in this. And once the woman enters in pregnancy in her adequate weight, she will be benefited. And as per guidelines, it is also suggested that when a patient comes to us for preconceptual counseling, we have to screen her for certain nutrient deficiencies. Like vitamin D deficiency is very common in Indian women, and we have to check for deficiency of vitamin D, vitamin B12, vitamin B6, B1, calcium deficiency. All this we have to screen her for. And if we find something is lagging behind, then we can give her supplementation so that she can enter in her optimum health. And folic acid metabolism and folic acid also plays a very important role in preconceptional period. Actually, the folic acid metabolism supports embryogenesis, or we can say it can affect embryogenesis or fetal formation. The neural tube is very much affected, that is brain and spinal cord development is very much affected by folic acid. So folic acid supplementation is very important for pregnant women, and ideally it should be started 6 weeks prior to conception and should be continued till third or fourth month post pregnancy, that is first trimester should be covered. So when a woman comes to us and she is very young, newly married, like married for 1 year, and she's planning a pregnancy, we just advise her go for natural relationship, start a folic acid supplementation, and this will help you. The dose is 0.4 milligram per day. That is enough, which is to be started 6 weeks prior and to be continued up to 3 months of pregnancy. But if a patient comes to us who is aged, like after 35 she has conceived, or her age is 35 and she wants to conceive, if she is having a previous history or family history of any neural tube defect or any congenital malformation, and if she is taking any anti-epileptic drugs, or if she is taking any folate antagonist, then we have to increase the dose to 0.5 milligram per day. And this is to be ideally started 3 months prior to pregnancy and to be continued up to 3 to 4 months of pregnancy. Similarly, thyroid also plays an important role. So when a woman comes to us, we do certain screen of tests like her hemoglobin level, her thyroid levels, her HbA1c, what are their sugar. These tests are to be done. After history, we perform certain tests to know whether she is fit or not. And for thyroid, a woman should enter the pregnancy in a euthyroid state. Like her TSH should be maintained between 2.5 to 3. The label target level is 2.5 to 3. If her levels are more than 3, we have to start her on some medication so that she can enter in a normal way. And iodine supplementation is very important. The government of India says like daily a woman should have an intake of 150 microgram of iodine per day so that her thyroid levels remain normal. And folate metabolism we have talked about, thyroid, and women should also be screened for hemoglobin because anemia is very prevalent in India. Like Indian women are mostly found to be anemic. So at first visit only, we check the hemoglobin of the patient so that if it is less, we can give her certain medication, we can give her certain supplements, we can counsel her for her diet so that she can have a better hemoglobin level. And if it is found very less, we do certain more tests like serum ferritin levels, serum iron levels to know about her iron stores, like since how long she has been depleted of iron, to know that levels. So diet is an important part in management of anemia. So we have to advise her that she has to take good care of her. She has to take proper iron-rich foods like jaggery, green leafy vegetables, lentils, cereals. If she is non-vegetarian is a good source of iron. Egg yolk is a good source of iron, and these all apples, pomegranate. This will all help her, and we will provide her certain supplementation, which will lead to a better hemoglobin level. Even Government of India also provides with iron supplementation in local PHCs or Anganwadis to all the women day by day. And it is recommended like 100 milligram of elemental iron is recommended for a woman of reproductive age group at least weekly. And once she enters in her pregnancy phase, it is like 100 milligram of elemental iron is to be given daily. Earlier it was weekly, and once she enters in a pregnancy phase, it becomes daily intake of 100 milligram elemental iron. And besides these investigation, hemoglobin, thyroid levels, in general weight monitoring, folic acid, covering all the nutritional deficiencies. When a patient comes for preconceptual counseling, we always ask them regarding the recent vaccination they have taken. Like if the woman has been vaccinated for rubella, she has taken MMR vaccine, then we ask her to avoid being pregnant for at least 3 months because these MMR vaccines can lead to congenital malformations in babies. It can lead to certain sort of mental retardation also. So we have to advise her not to get pregnant in the phase of 3 months, and then after that she can plan her pregnancy. Similarly, many patients come that they have recently taken influenza vaccine, but we say it is very safe in pregnancy and they can take all these vaccines and can have the pregnancy together. And also the screening for HIV, AIDS and STIs. It is also very important because once you are tested positive for these STIs or HIV, all the scenario of pregnancy changes. It's like your happiness, your planning, all the thing changes, your partner thing changes. So it's very important, like you have to undergo these certain tests. Certain history is important, and then you have to ask your physician, your gynecologist, so that she can help you. And once you are in your optimum health, then you can enter in your pregnancy phase. So that was in general regarding preconceptional counseling, like what we do when a person comes to us for a first visit and he or she says, like husband and wife says, we are soon planning for getting a pregnancy and just want information. So we go for a history, a detailed examination, detailed screen of test, and then we advise them certain medications, certain supplements, like this. So let's now go to our live chat. I think I'm having number of questions. I will answer one by one. I will answer the question from Varsha. She is asking me, why is preconceptual counseling important? So the answer is, I have already mentioned there are a number of benefits. If you are entering in your pregnancy phase without any counseling, you will usually visit a doctor once you see your UPT is positive, and you will miss that 1 month period, like 4 weeks. In these 4 weeks, already organogenesis have been done. Like बच्चा ऑलरेडी बन चुका है, जो उसके दिमाग, स्पाइनल कॉर्ड, ये सब है, ये पहले ही बन चुके हैं. तो आप वो 1 मंथ का पीरियड मिस कर देते हो. अगर आपने प्रीकंसेप्शनल काउंसलिंग की हुई है तो आप वो 1 मंथ का एडवांटेज भी अपने छोटे से फीटस को दे सकते हो. एटलीस्ट फॉलिक एसिड तो मिलेगा उसे. So I think it's beneficial, and a number of benefits I've already told. Less chances of CMF, less chances of preterm birth, IUGR babies, less chances of any pregnancy related complications. Taking to another question. Number of patients are saying hello, hi ma'am. So hello everyone. I am Dr. Puneeti Ballega Gandotra once again, and I am here to have a live chat with you regarding preconceptional counseling. You can also follow me on BabyChakra app online using a referral code PUNB, that is in capital PUN and B. Taking another question from Varsha. She's asking, what should I do before conceiving? I want to know what is your age. Like, if you are a newly married couple, your age is like you are a young girl, like around 24, 25, 26, then you just go to a gynecologist. You just ask her to do a certain number of tests she will do. Of course, she will herself do, like your hemoglobin level, your thyroid levels. She will take a detailed history, like whether you are having some ailment or not. And depending on that history and that investigation report, you are advised what to do. If everything goes well, you are just given a folic acid. At least folic acid is very important for the growth of the baby. You have to take that folic acid supplementation, and it will, of course, help your baby. Taking another question. Just a second, I need to know. Someone is asking me, should my husband also go for preconceptional appointment? Varsha is asking me. Of course, your husband is going to be a father. Like you are going to be a mother. You need to be healthy. Your husband is also going to be a father. So I think he should have a very important part. Like उसे भी पता होना चाहिए कि तुम्हें क्या चाहिए, तुम्हारे बच्चे को क्या चाहिए. तो अगर तुम्हारे बारे में वो जानता होगा कि हाँ इसको ये प्रॉब्लम है, मुझे इसका इस तरह से ध्यान रखना है, हम दोनों को इस चीज़ का ध्यान रखना है, तो ऑफ कोर्स यू विल हैव अ हेल्दी प्रेगनेंसी and a healthy relationship. Of course, the bond will become stronger between you and your husband. So husbands are important part of these counseling. And once you are found to have certain disease, so he will also take care of your sugar levels, your hypertension. Husbands are very important. Taking another question. Meghna is asking me, I'm taking another question. Now Meghna is asking me, I had 2 miscarriages, both at 6 weeks. After my second miscarriage in June 2020, I had PCOS. I'm 29 years old, BMI is 26. What can be done to overcome PCOS? Period cycle is normal. When again I can plan for pregnancy? सी मेघना, अभी आपका जून 2020 में ही अबॉर्शन हुआ है, तो आई वुड से लाइक गिव योर बॉडी टाइम. ऐसा नहीं है कि एक अबॉर्शन हुआ एंड यू आर जंपिंग फॉर द अनदर प्रेगनेंसी. टेक टाइम. एटलीस्ट 4 to 6 months are needed for your body to again build up to become pregnant. Take some time. In this time, at least maintain your weight. Your weight is ideal, no problem. BMI 26 is fine. But PCOS is basically some hormonal disturbance. So be fit, exercise regularly, take proper well-nourished diet, avoid junk food. This will help with your PCOS. If your cycles are regular, like 29 to 34 days, no problem, you will conceive by yourself. You won't have to take certain medications to conceive, but avoid pregnancy at least for 4 to 6 months. Taking another question. I've already told you, like, is preconceptual counseling important? Yeah, of course, it is very important. And I'll take question of Sana. She is asking what is included in these preconceptual counseling. I have already told you in my lecture, like when a patient comes to us, we take a detailed, thorough history, like past history, present history, personal, family history. We will take a detailed history. We will modify her risk factors. If she is having certain disease, we will try to control that disease with minimum medications, because medications affect fetal growth and development. So we will try that her body comes in control first, and then we advise her to become pregnant. Coming to next question. When should you have a preconceptional appointment? Sana is again asking me. So the ideal time is 3 months prior to your planning. Like when you are planning for a baby, at least 3 months you have to take, because if you find some abnormality, your body takes minimum 1 to 3 months. So 3 months period is ideal before pregnancy. Another question from Kiara. Yeah, just a second. Another question from Sana, I'll take. Do you need to see a gynecologist before getting pregnant? Yes, of course, you have to see a gynecologist, you have to see a dietitian before getting pregnant, because they will advise you, they will make your body under control, they will make you healthy before you become pregnant. I think planned pregnancies give better outcomes. So once you visit a physician, a gynecologist, or a dietitian, you will end up in a planned pregnancy, and this will yield better results for both you and your baby. Next question is from Kiara. What is pregnancy after 35 called? Like Kiara, 35 age is not like a age limit, like you can't get pregnant after 35. It's not like that. It's just like you are a elderly mother, like you are going to be a elderly gravida. So certain risks are there with your age, like you are more liable to have pregnancy related hypertension or diabetes, but nothing to worry, nothing happens with all. So I would say ki if you are not having a child and you are 35, just go for the pregnancy. Before pregnancy, visit a gynecologist. She will advise you certain number of tests. She will examine you properly, and you will end up in a happy pregnancy, no problem. But just take care of yourself, because age related problems do occur. Another question I will take from Kiara. Can I get pregnant with low egg count? Of course, you can get pregnant, but the chances of fertility reduces as the number of eggs decreases. I think you go to a gynecologist. She will advise you a test called anti-Mullerian hormone. This is AMH levels will be checked. And if your AMH levels are normal, no problem, you can conceive. Other question I'll take. What should I do before conceiving? Sana is asking me. Sana, before conceiving, I would say become a healthy woman first and then plan for a baby so that the baby can also be a healthy one. Go to a gynecologist, have your detailed history, your detailed examination, certain set of tests, which will lead you to know that you are a healthy woman. And if everything goes well, just start folic acid supplementation, like I have told you, zero point 0.4 milligram daily. Start it 6 weeks prior conception and continue it for 3 months, and there will be no problem. Why preconceptual counseling is important? Another question. Same, I have repeated many times. I'm dealing this lecture also because it has many advantages. Like you will be healthy, your baby will be healthy, your pregnancy will be uncomplicated. So everyone around you will be happy. Another question, same. Is preconceptual counseling necessary? Actually, it is very common. Preconceptual counseling is very common in abroad. Like people go for counseling for each and everything. But in India, it is in its infancy. Like people don't visit a gynecologist unless they found two lines in their urine pregnancy test. So if they go for a counseling before pregnancy, it will definitely help. It will reduce pregnancy related complications. And if you are taking certain drugs like for drugs for diabetes, hypertension, or in general you are taking anti-acne drugs, your gynecologist will help you and will modify your drugs so that you can avoid them. These drugs cause teratogenic effects in your fetus, so these can be avoided. I think I have answered all the questions. I think I have answered all the questions. Any more queries? So this was me, Dr. Puneeti, chatting with you on preconceptional counseling. It was nice to have you all, and I hope like now many of you will have planned pregnancies. You won't go to your gynecologist only after becoming pregnant. You will first visit her before planning your baby, and this will all help you. So I think that's totally done. If anyone wants to ask another question, I am available here for some more time. Another one more question I have seen. What are the symptoms of not ovulating? Kiara is asking me. Like ovulation does not happen in mostly in the PCOS patients. Symptoms are not very like stringent symptoms are not there. Symptoms are not very peculiar. You might not feel that pain on 14th day. Usually women feel like on 14th day of their menstrual cycle, you usually feel some sort of pain. So the persons who are not ovulating usually don't feel that pain. Usually their cycles are irregular or prolonged cycles or delayed cycles they have. Another question. My cycles are not regular. I get my periods after 2 to 3 months. I have PCOD. There is a less chance of me to get pregnant. If yes, what I can do to increase my chances? I would like to answer this question. Like Shruti, you have been asking me your cycles are not regular. It's a 2 to 3 month cycle. So I think with the PCOD background, I think it's proven in ultrasound also. So there are not less chances of getting pregnant, but it takes time. You can either have some ovulation induction drugs. I want to know your age, that also matters. If your age is fine and you are having a PCOD background, your weight is fine, then you will, of course, land up in getting pregnant. But if you are obese, try to control your weight, have some lifestyle modification, have some dietary changes. There are certain medications also for PCOD to regularize your period, certain ovulation induction drugs which will help you to ovulate, and then there are chances for conception. Another question, um, what can be the reason for irregular periods? Jayaram B is asking me the reasons for irregular periods. There are a number of reasons for irregular period. The most common, which is in Indian women, is PCOD. Like around 30% of Indian women are having a PCOD background, and this leads to irregular period. Another important factor is your diet. If you are having a deficiency or some sort of deficiency inside you, of course, you will not bleed much. So, have a proper diet. Certain hormones also affect your periods. Have a proper diet, check for PCOD, get an ultrasound done, go for certain tests like thyroid profile, T3, T4, TSH. Prolactin levels need to be checked. If you are having increased prolactin levels, then because of hormonal imbalance, you get irregular periods. So I think you should go for certain tests and ultrasound. Another question from Shruti. I was asking her age, and she has told me she is 32 years old with normal BMI and with the PCOD background and not able to conceive. 32 is fine. You will take time, but you will conceive. Another question I would like to take. Abjeet is asking me that her wife's HSG test was normal and his sperm count was on borderline. He's taking medications also for that for last 2 months and last year, but he's not able to conceive. The answer to this is first let your sperm counts be become normal. You are taking treatment, that's fine. Your wife HSG is normal, it means her tubes, her uterus, ovaries are working well. Once your sperm count will become fine, you can undergo intrauterine insemination. This will increase your chances of conception by around 15%. Another question, should you do a preconceptual counseling before getting pregnant? Of course, look for this lecture. I have told you a million of benefits of these preconceptual counseling. So I think you should definitely go for this. Is it important for both husband and wife to have the counseling? Answer is definitely yes. You both need to undergo counseling. He is your partner. He should be aware of your body. He should be aware of his own baby. So definitely husbands are also should be there. Another question. I am 35 years of age and no babies yet. Should I consider a counseling before I try to get pregnant? Yeah, definitely you should undergo a counseling. You should visit a gynecologist. You should find the reasons why you are not going to become pregnant, why the pregnancy is not coming. 35 age is not a bar line like you are 35 so you can't become pregnant. You have to visit a gynecologist, undergo certain tests, certain examination to find the reason why this is happening. And then your gynecologist will give you certain ovulation induction drugs which will help you conceive. Other question, is preconceptual counseling necessary? Again and again I am saying it's very beneficial, it's very important. लाइक जब हम कोई नई गाड़ी भी खरीद रहे होते हैं तो हम बहुत प्लानिंग करते हैं, तो बेबी तो मतलब लाइक सबके लिए बहुत प्रेशियस है, तो आई थिंक उसके लिए प्लानिंग तो ज़रूर होनी ही होनी चाहिए. अदर Bharti Singh, hi to me. Hi Bharti, watch my lecture. Hello everyone. Again, someone is asking me, do you need to see a gynecologist before getting pregnant? Yes, of course, you have to see. At least a one visit, which will hardly cost you approximately rupees 300 or 500, will give you a number of benefits. At least you are sure that before getting pregnant, you are in a state of a healthy phase. Before getting pregnant, you are so much healthy that you can take care of your baby well, you can take care of your fetus well. There will be no future problems with you if you have undergone this one visit. Other question is, someone is asking me कि मेरा बच्चा बहुत परेशान करता है, दूध नहीं पी रहा, खा नहीं रहा. आई थिंक इसके लिए तो आपको किसी पेडियाट्रिशियन को कंसल्ट करना पड़ेगा, क्योंकि 11 मंथ का बेबी यूजुअली गायनिकोलॉजिस्ट नहीं देखते हैं. बट इवन दो आई वुड से डू ट्राई, आर यू ब्रेस्ट फीडिंग हर? लाइक अगर आपका दूध अभी तक पी रहा है और अब नहीं पी रहा, तो जस्ट चेक कि कोई उसके मुंह में छाले तो नहीं हो रहे, कोई टीथिंग की प्रॉब्लम तो नहीं है, to find the reason कि stomach में कोई infection तो नहीं है. Otherwise just try and give her food. Like 11 month का baby तो like 1 year उसको तो लेना ही लेना चाहिए. Better to consult a pediatrician. I think I have answered before also Shruti's problem. To increase her chances, she need to take a proper lifestyle. She need to modify her diet, and then can undergo ovulation induction, or if not conceives with that too, she can undergo intrauterine insemination. First of all, get your cycles regular. Your age is 32 and you are not getting proper cycles. Get your cycles regular first, and once these are regular for nearly 3 months, you can try for ovulation induction drugs. I have answered this question of Shruti earlier also. There are chances, don't worry. This also I have answered. Abhijit question, like make your sperm count better first and then try for pregnancy, because a baby will come with the effort of both father and mother. Only mother can't do everything. This is the same question of Abhijit. I have answered. Yeah, coming to this question, कोई healthy diet suggest करें. I would suggest like अगर आप प्रेगनेंसी प्लान कर रहे हैं तो पहले तो जंक फूड खाना बंद करें. जंक फूड से कोई भी बेनिफिट नहीं होगा. Like take a healthy diet which is full of, it should be a balanced diet. It should include everything like carbohydrates, proteins, vitamins, minerals, everything should be there, including roughage also. Like intake of salad and fruits is very important. uh, Take proper diet, take proper salad intake, food intake, all beans, dals, lentils, cereals, everything should be included in this balanced diet. And also do workout also. It's not like you are eating and eating only. Workout is very important. Maintain an adequate weight, like it should be optimum weight, optimum BMI, and take healthy diet, healthy workout. This will surely help you in every case. Also start folic acid supplementation. If you are found to have certain deficiencies like B complex deficiency, vitamin D deficiency, I've already said it's very common. So then take supplementation for these vitamin D pearls. You can take B complex capsules. You can take folic acid is very important. Other question is, what should you avoid when trying to conceive? At least if you are in a habit of smoking or alcohol intake, say a big no to them. Smoking and alcohol are very dangerous for your baby, for your own child health. If your partner takes these things, ask him also to avoid these things. This will yield a better result. Avoid taking unhealthy diet. Take a proper healthy diet. Avoid your bad habits. Get yourself tested for certain tests. Certain vaccinations are important before getting pregnant. Like if you are living in an area susceptible for hepatitis, undergo a vaccine for hepatitis B or MMR. But just avoid pregnancy immediately after taking these medications or these vaccinations. You take some time. Once you are fit, your medication and the pregnancy period is nearly 3 months have been there, then you can plan pregnancy and start taking folic acid. Is 30 a good age to get pregnant? Yeah, of course. No problem. Once you are 30, it doesn't mean you can't get pregnant, but it's better if you get pregnant at an earlier age, like 24, 25. You are young enough, you can take care of your baby in an energetic way, like I can say. After 30, you become somewhat dull. But otherwise, 30, 35, 40 even is not a problem. क्या क्या प्रिकॉशंस लेने चाहिए अच्छी प्रेगनेंसी के लिए, रिद्धि पूछ रही है। तो इसके लिए ये है कि अभी आप अगर अच्छी प्रेगनेंसी सिर्फ प्लान कर रहे हो तो बेटा अच्छी डाइट लो, अच्छा हेल्दी लाइफस्टाइल रखो, डल नहीं होनी चाहिए, बी एक्टिव, बी एनर्जेटिक, एक्सरसाइज करते रहो। कुछ सप्लीमेंट्स इंपॉर्टेंट होते हैं, फॉलिक एसिड, आयरन, जो मैंने पहले भी बोला है। आपके बॉडी स्टोर्स अच्छे होने चाहिए, तभी आप अपने बेबी को नरिशमेंट अच्छा दे पाओगे। तो अच्छी डाइट लो, अच्छे से रहो, खुश रहना सबसे इम्पोर्टेंट है। बी हैप्पी, बी हेल्दी। Is it harder to conceive after 30? Ahana is asking me. No, it's not like that. Being a gynecologist, I would say no. Like, it's not like that. You can't conceive after 30. You can. कोई एक्सरसाइज जो हेल्प करे? एक्सरसाइज बहुत तरह की होती हैं। इफ़ यू आर ओबेस, आई वुड से यू स्टार्ट जॉगिंग, स्टार्ट जंपिंग, start some aerobics or join some gym. But if you are in an average weight, do regular household work, take a healthy diet, and just be active. Or daily 30 minutes walk in the morning or 30 minutes walk in the evening will suffice. Walking, I think, is very important. Don't be sedentary. Someone is thanking me, so welcome. I would always be there to help you all. Yeah, this question is very important. Like, what do preconceptual vitamins do? I have already told you that folic acid metabolism plays an important role in embryogenesis. यानी कि बच्चे के बनने में कुछ vitamins और कुछ minerals का बहुत बड़ा हाथ होता है। जब बच्चा बन रहा होता है, उसका दिमाग, उसकी रीढ़ की हड्डी बन रही होती है, तो उस समय कुछ बॉडी में कुछ मेटाबॉलिज्म चल रहा होता है, जिसकी वजह से सब कुछ ठीक से चलता है। अगर हम में कोई कमी है विटामिन की, मिनरल्स की, तो वो मेटाबॉलिज्म या कुछ हार्मोन्स अफेक्ट हो जाते हैं। तो प्री कंसेप्शनल वाइटामिन्स, जिसमें से फॉलिक एसिड सबसे इम्पॉर्टेंट है, आपको लेना ही चाहिए। अगर आप स्टार्टिंग में नहीं लेते हो प्रेगनेंसी से पहले, एकदम जब पता लगता है कि हाँ 2 लाइन्स आ गई है, आई एम प्रेग्नेंट, अब मैं डॉक्टर से मिल लूँ, उसके बाद फॉलिक एसिड शुरू करूँ, तो तब तक तो बच्चे का दिमाग ऑलरेडी बन चुका है, तो वो आपको इतना हेल्प नहीं करेगा। अगर आप पहले से ले रहे हो तो वो आपको काफ़ी हेल्प करेगा। फॉलिक एसिड ओवरडोजेज से कोई साइड इफेक्ट नहीं है, नहीं, ओवरडोजेज से कोई साइड इफेक्ट नहीं होता, क्योंकि ये वाटर सॉल्युबल विटामिन है। आपके यूरिन में ये पास आउट हो जाएगा, आपको कोई इसकी ओवरडोज से साइड इफेक्ट नहीं होगा। बाकी रूटीन जो मेडिसिन आती हैं वो भी 5 मिलीग्राम की आती हैं, 5 मिलीग्राम डोजेस वेल इनफ। दिन में एक बार एक फॉलिक एसिड की छोटी सी गोली लेने से आप बहुत सारे नुकसानों से बच सकते हो। What is the best vitamin to get pregnant? Best vitamin is, I must say, folic acid. What vitamins do or what vitamins help you to get pregnant? They don't actually help to get pregnant. You get pregnant when your sperm and your ovum meet inside the fallopian. But these vitamins make a hormonal milieu, और you can say कि एक ऐसा environment ये create करते हैं कि सब कुछ अच्छे से मिल जाता है। Like एक पौधे को बढ़ने के लिए हमें पानी, खाद सबकी ज़रूरत होती है, तो वो पौधा तो बन रहा है आदमी और औरत के अंडों के मिलने से, पर उसको आसपास की चीज़ें भी साथ में चाहिए सब कुछ सही रहने के लिए। तो vitamins important हैं। कोई स्ट्रेस फ्री रहने के लिए टिप्स बताएं डॉक्टर? स्ट्रेस फ्री रहने के लिए मेडिटेशन कर सकते हो। खुश रहना बहुत इम्पोर्टेंट है। आई नो ऑफ कोर्स प्रेग्नेंट होने के लिए हम सबसे पहले यही कहते हैं कि सारी चिंताएं छोड़ दो, स्ट्रेस फ्री रहो, अपने आप प्रेगनेंसी हो जाएगी। तो स्ट्रेस फ्री तो ऑफ कोर्स रहना ही रहना है, जिसके लिए आप मेडिटेशन कर सकते हो। आपको जो चीज़ें पसंद है आप उनमें अपना मन लगा सकते हैं, जैसे जिनको डांस पसंद है, कुकिंग पसंद है, वो करें। आजकल प्राणायाम के लिए बहुत बोला जा रहा है, आप वो कर सकते हैं। मेडिटेशन विल ऑफ कोर्स डेफिनेटली हेल्प यू। Does folic acid improve egg quality? It basically does not improve egg quality. It basically improves the quality of your embryo, because embryogenesis के टाइम पे folic acid metabolism काम करता है। Folic acid food diet for 4 weeks women. आई थिंक व्हेन यू आर जस्ट प्रेग्नेंट, लाइक 4 वीक्स इज कि आपको पता ही लगा है कि आप प्रेग्नेंट हुए हो, उस समय थोड़ा नोजिया, वॉमिटिंग, गेस्ट्राइटिस की प्रॉब्लम ज़्यादा रहती है, तो आप बहुत हैवी फूड तो नहीं ले पाओगे। बट आई थिंक यू शुड स्टार्ट टेकिंग फ्रूट्स प्रॉपरली, एटलीस्ट दाल, सब्जी, कटोरी ये सब प्रॉपरली लो। राइस, रोटी जितना खाया जा रहा है इट्स ओके। मिल्क इज़ वेरी इंपॉर्टेंट, डेयरी प्रोडक्ट्स आर वेरी इंपॉर्टेंट। दूध, दही, पनीर ये सब अच्छे से लो। डेयरी प्रोडक्ट्स जो होते हैं, फ्रूट्स पे बैलेंस दो अच्छे से, क्योंकि इस फेज में थोड़ी कॉन्स्टिपेशन की प्रॉब्लम भी रहती है मोस्टली पेशेंट्स को। तो आई वुड से कि रफ वेज इनटेक अपना अच्छा रखो, जो खाया जा रहा है खाओ, एंड ट्राई अवॉइड टेकिंग, लाइक पपाया मना करते हैं इनिशियल प्रेगनेंसी में, तो पपाया अवॉइड करो। अदरवाइज सारे फ्रूट्स आप खा सकते हो। जूसेस अवॉइड करो, जूसेस से थोड़ा गैस्ट्राइटिस होता है। बाकी फ्रूट्स ले सकते हैं। दिस आई हैव ऑलरेडी आंसर्ड। मैंने पहले ही इसका आंसर दे दिया था कि स्पर्म काउंट ठीक होगा तभी प्रेगनेंसी हो पाएगी। एंड हाई टू एवरीवन। एनी मोर क्वेश्चंस? If you're having further more questions, you can have me on BabyChakra platform. I'm always there. You can leave your questions. I will answer them as possible. And you can just use my referral code PANVI. I will always be there with you. I think I have answered all. सो नेक्स्ट टाइम प्रेग्नेंट होने से पहले एक बार डॉक्टर की विजिट ज़रूर कीजिएगा। किसी से भी मिलें, आप गायनेकोलॉजिस्ट से मिले तो बहुत अच्छी बात है, नहीं तो एक फिजिशियन, एक डाइटिशियन भी आपको बहुत हेल्प कर सकती है। डाइटिशियन का प्रेगनेंसी में बहुत इंपॉर्टेंट रोल है। तो डाइटिशियन, गायनेकोलॉजिस्ट, फिजिशियन, एंडोक्राइनोलॉजिस्ट सब मिलके जो मल्टी डिसिप्लिनरी अप्रोच होता है आपको बहुत हेल्प करेंगे। आप आराम से प्रेगनेंसी के फेज में जा पाएंगे, आपका बच्चा हेल्दी होगा, कोई बर्थ डिफेक्ट्स होने के चांसेस कम होंगे, एंड अच्छे से प्रेगनेंसी निकलेगी। बीपी, शुगर, ये प्रॉब्लम आएंगी, अगर कुछ है प्रॉब्लम तो आपको डॉक्टरों ने सॉल्व करेगा। आपको कुछ ऐसी दवाइयों पे डालेंगे जिनसे आपको ज़्यादा प्रॉब्लम ना आए, आपको या आपके बच्चे को ज़्यादा तकलीफ ना हो। जैसे डायबिटीज ही है, उसमें हम पहले कुछ दवाइयाँ देके शुगर को कंट्रोल करते हैं, पर बाद में हम मरीज को डाइट और इंसुलिन पे डाल देते हैं। तो लाइक अगर पेशेंट हमें जल्दी मिलेगा तभी हम उसकी चीज़ें चेंज कर पाएंगे। अगर वो मिलता ही छठे सातवें महीने में है और वो वही दवाइयाँ खाए जा रहा है जो वो प्रेगनेंसी से पहले शुगर के लिए खाती थी, तो वो नुकसान पहुंचा सकती हैं। तो बेटर है आप टाइमली डॉक्टर से मिलें, पहले अपनी शुगर कंट्रोल करें, उसके बाद कुछ दवाइयों का चेंजेस होगा, सारी प्रेगनेंसी स्मूथली निकलेगी। इसी तरह से बीपी में भी होता है, लाइक आराम से प्रेगनेंसी निकालने के लिए आप पहले बीपी कंट्रोल करें। 130-80 बीपी आपका जो हमारा टारगेट रहता है उतना या उससे कम की तरफ रहना चाहिए अगर आप हाइपरटेंसिव पेशेंट हैं तो। और बीपी कंट्रोल होने के बाद ही आप प्रेग्नेंट हुए तो बहुत अच्छा है। फिर भी बीपी कंट्रोल नहीं होता कुछ पेशेंट्स में, तो हम कुछ दवाइयों का चेंज करते हैं जो बच्चे को नुकसान ना पहुंचाए। तो काउंसलिंग और अर्ली विजिट टू अ डॉक्टर वंस यू आर प्रेग्नेंट इज वेरी इंपॉर्टेंट. I think that's all I want to say. Thank you so much. It was very nice to have you all today. And number of questions I have answered, I think, are well enough. And hope to see you all again. Thank you. Thank you so much.